very good morning to you. Well, it's just turning 10:30. It's Joanna here with the Community Link, and I'm very pleased to have in the studio this morning Lisa. We've just been having a chat about WISE and what we can tell you about WISE. So good morning, Lisa.
Good morning. Thank you for having me this morning.
It's an absolute pleasure. I was just so excited when Terry sent me the information about you, and I was looking up about WISE because I hadn't heard about WISE. I didn't know what it was. So, what can you tell us about WISE then, please, for our listeners?
Well, it's quite a new service, so that's probably why you haven't heard of it. But it's a new service, a new holistic service for the Cymraeg Morgannwg Health Board. And it's a service that's led by coaches, so wellness health coaches. And we support patients who are over 18, so at the moment over 18, who have any chronic symptom or chronic disease, or if they're on an NHS waiting list or at risk of going on an NHS waiting list. If they feel that they could benefit from having a coach, then they can come to us and we can help support them to live well with their condition, try and reduce the burden of the symptoms, and basically start to feel better and look at long-term good health rather than just focusing on the one disease or symptom that they've got.
And can I ask you, because I always get mixed up between chronic and acute.
Yeah.
What's chronic condition?
So chronic is anything that's been going on for longer than 12 weeks.
Okay.
So, for example, if someone has pain in their knee and it's gone on for over 12 weeks, then you would class that as chronic. So long-term or ongoing are other ways of describing it.
Okay. And what kind of conditions are we talking about then?
Oh, literally anything. So we've tried to create something that will serve the majority of our population and start shifting things to focusing on wellness. And how do we focus on really good health and feeling good and living a really good life that you can do whatever you want without your health conditions sort of holding you back? Because I'm sure you know lots of people who do feel like their health conditions are holding them back from doing the things they want to do or spending time with their family. So that's the focus of the service, really, is how do we get people to look after their own health, manage their own health, their own symptoms, to be able to do the things that they want to do so they don't feel overshadowed by health conditions.
And what sorts of things are you offering in that service at the moment then?
So the way it works is someone can self-refer to us, so go on our website and just Google ctm.wise or email us or phone us, and then one of our team will call the patient and explain the service, book them in for a one-to-one with a coach, and that coach then goes through what really matters to that person. What would good health look like? What are your goals? How do you want to feel? And once they've done those baseline assessments, including things like blood pressure, weight, waist circumference, so you really know and understand your own health and your starting block, you're booked in then to coaching program with your coach, and you can have that coaching for up to 9 months. So some people would choose like 4 months, 6 months, or even 9 months, depending on how severe your health problems are and what you want to achieve. So they come to group coaching that are across the whole of the Cymraeg Morgannwg area. So they're in community venues. We try and make it as easy and as accessible for everyone. And then on top of that coaching, you can also see me or another medic that have got an interest in what's known as lifestyle medicine. So that's where we prescribe lifestyle changes that have got evidence to prove that they can change your long-term health conditions. And then we've got access to all sorts of other things. So artists, movement specialists, yoga specialists, music therapists, Get Fit Wales are part of it. So they'll offer Fitbits for the patients. And as they meet their step goals, for example, you can get vouchers to spend in local small businesses. So in a fruit and veg shop, in the butchers. I think they're even offering like Amazon vouchers.
Wow.
So anything that helps you and incentivizes you to get better and use the community. You know, we've got such fabulous resources in our communities and so many amazing groups out there that want to help people to feel better. So we're linking into everyone that's out there.
It's very empowering.
Yeah, it's all about empowering people to feel that they've got a control over their own health and well-being. Like, as a doctor, I don't want people to feel like I've got control over their health and well-being and it's just me that's in charge of it. I want to feel like I'm in a partnership with my patients.
And when you said they have a meeting, is that an in-person meeting or is that an on-phone or Zoom meeting?
They can choose, actually. So we've tried to make it as accessible to everyone. So, we know lots of people work or have really busy lives and it's harder to come face-to-face. So patients can choose either having it virtually, so via phone or video calls or on a tablet. And if people want to do it virtually, but they might not have internet, so they might have digital poverty, they might not have a tablet or a laptop, then we partner with a Welsh charity that can go in and give all of that to patients. so that they're not. So they're not.
They can still access
by that. They can still access it. But interestingly, most patients are choosing face-to-face, so choosing venues that are local to them. So that's been quite interesting. So people can choose from the outset which they want to do.
And that's initially a private consultation, as in that person with the doctor.
The first one, is 1-to-1, and then they get a 1-to-1 then at 3 months, 6 months, and 9 months to make sure we're actually helping them to reach their goals. But the rest of it is done in group settings.
Right. And where do they have to go for the group setting?
So it depends on where they live.
Yes.
So we choose venues that are as close to people's postcodes as possible, and on transport links and accessible to anyone. We have to make it as easy as possible, as you can imagine. But it's in things like rugby clubs or leisure centres or community centres. The coaches have spent a long time travelling about and trying to find really good venues for the patients.
I bet they have. How long have you been going?
So it's only been running for a few months, so we're quite new, but we're already getting very good traction and really good feedback. So we're working with the patients who are involved at the moment to try and make it bigger and better and deliver what people want.
And you said that people can be referred and self-refer, and that information is on the website. If you could just say the website again. Yeah,
so if you just Google or whichever search engine, if you type in WISE or Wellness Improvement Service, then you'll find it. Or if you go on the Cwm Taf Morgannwg University Health Board and put WISE into that search engine, you'll find it.
And I have to say, I was looking at it this morning over breakfast, I was telling you, and it's just for anybody who's thinking, I'm not used to websites or I don't like looking at this, it is so easy and so user-friendly. Yeah. There's short videos, there's images, looking at food and food proportions. I love the way you use hands to look out how much cheese and butter you should have, or some vegetables and meat. I have to say, I think I'm a little bit high on my fat content, a little bit more than the end of my first finger. But it was just fantastic, really, really easy and user-friendly to look at different areas. So definitely, if anybody's thinking about that, have a look at the website, because it's really accessible, really informative and educational. I thought it was fantastic. Really well put together. And who have you got at the moment? Have you got any particular age ranges going? I know you said you're over 18 at the minute. So,
well, it's a real mix actually. So it's anyone and everyone, because we don't categorise people based on their disease. So you don't have everyone with diabetes or everyone with depression or everyone with chronic pain. Because the service is designed to look at you as a whole person, it doesn't really matter what your health problems are. It matters what's important to you and how we can actually help you overcome the barriers to getting control over your health and reducing those symptoms. So everyone's sort of mixed together. So it doesn't matter what your background is. And then the whole group together will help you to achieve your goals. Like, that's what we're seeing is one patient's life experience can help another patient. So the sessions are fantastic in how they're transforming people's lives and building up connections and making you feel like, actually, in this community, I've got a lot of support and I'm not on my own. That's repeated all the time. Patients say, I'm not on my own anymore. I don't feel like, I feel like normal again. I feel like a real person. And, this person, this group gave me some really powerful advice that's changed my life.
And we were saying earlier, you talked about sometimes somebody gives advice that actually it's the advice that they need to take too for themselves. Yeah. So even that communication helps them to recognise that often we kind of might have the answers to our own questions. Yeah. But being in that environment and feeling that you're helping somebody else is just allowing you to see and hear that. And sounds wonderfully supportive.
Yeah, well, as most humans are very compassionate in how they are, and we can't help but want to help someone else. So when you're in a group and someone's sharing a difficulty that they have, or you notice that they're really struggling or suffering, you can't help but try and help that person. And that's what we see in these groups all the time, is the group together rally around and offer actionable steps that people can take. And then that's when the coach will say, well, actually, that's really good advice. Like, maybe you should do that as well. And they go, of course, I could do that, or we could do that together. So there's so much good evidence that group-based sessions is extremely powerful, and patients actually have better experience of the health service in that way, and they get more out of it, and they get more understanding of their condition. So even people who don't want to be in a group or don't feel like it's for them, or they don't feel like they could share, even those people, once they give it a go, they say, actually, I didn't realise it would be so helpful, and I didn't realise I would feel as comfortable as I am, but it really has changed my mind about group sessions.
It's very powerful. It's like birds, isn't it? And animals, often they're in herds and flocks.
Yeah.
And I guess perhaps for a long time maybe we've just gone solo as humans, and now we're reconnecting again and recognising the value in doing things together. So when you mentioned there's different lengths of programmes, how do people decide what length of programme they think they should choose?
Just as they go along, really, so they can work with their coach and see how they develop, and how, because you might find that someone's initial problem is resolved and they feel a lot better, but actually they want to aim for even better wellness, or get even fitter or even stronger, or improve their diet even more. So then they will naturally want to stay on for longer. So it entirely depends, really, but they have got the option of having that extended coaching and extended support, because although the measures can seem really simple, they're not easy in practice. Otherwise we'd all be walking around in the picture
super
of
health.
We all know what we need to do, but actually we've got a lot of barriers in our modern communities to living well and living a healthy, long life.
Who else did you say is involved in WISE? Because you said you're working with other partners, didn't you, too?
Yeah, so anyone basically who also wants to help people get better. So we're kind of linking up with anyone who's aligned in let's focus on wellness, not illness. So we focus, we partner up with a lot of third sector organisations, so community groups like the Men's Sheds, and Get Fit Wales, Mental Health Matters Wales. So too many to mention, really. And then the main service then is led by our coaches that are trained in health coaching. And then there's me and Dr. Roberts Jones, who also who we specialise in this lifestyle medicine. So those pillars are improving sleep, because obviously when we sleep, that's when we rebuild and regenerate our body. Social connections, so that's the connections you have with the people around you, or your support network. Things like work, socialising, your identity as a person. So there's lots of evidence to show that actually if you improve that, you live longer. Healthy eating, so we look at what dietary changes are evidence-based to improve long-term health. Physical activity, so any kind of movement that makes your body stronger and fitter and more mobile. And then mental well-being is the other one. So how do we improve our mental health? Because physical and mental health is linked. So even if you've got heart disease, you're more likely to have depression. If you've got depression, you're more likely to develop heart disease. So they're really linked. So we need to look at people as whole people in order to actually create health.
Yeah, marvellous. And you said you've got coaches. I noticed on the website as well. How do people get involved if they want to maybe apply to be a coach, or if they want to volunteer, or the volunteering options, or what else can you tell us about that? Yeah,
so the volunteering services are key for our service as well. So we've got a volunteering service inside the health board, so please contact the volunteering service if you want to be part of that, because they will support the coaches then in the sessions. And especially for people who are a bit nervous or don't like walking into the group setting, the volunteer can meet you at your car and walk you in, so you're not by yourself. And also a lot of the volunteers have got real world experience themselves, or life experience, or they've been through self-management programs before, so they can offer their personal experience. And then we've also got social prescribing apps or self-management apps as well, so we can recommend evidence-based apps that can help improve symptoms. So if someone says, sleep is my biggest problem, then we can actually give you the apps that have got the best evidence for effectiveness.
Wow.
So we do that as well.
Wow.
And then obviously we link up to all the social prescribing links in the community, so we know there are people out there who are have got the directory of everything that's available. So we link up to them as well.
And if they wanted to be a coach, are you still looking for coaches? So there'll
be jobs coming out soon, I think, so on the NHS jobs website. So yeah, please look out for that as well.
Marvellous.
But our plan is, we want to build this. We want, my dream would be that everyone in Wales can have access to a coach to support them to better long-term health. So that's my aim, really, is that we get more and more coaches that can help transform people's lives.
So at the moment, this is in the Taff Morgannwg.
Yeah, so at the moment it's for Taff Morgannwg Health Board, but lots of other health boards are interested in the same model, so we're kind of sharing all that we've learnt and all we've got so far. And Aline Morgan, the health minister, came to see us last week, and she was really supportive of this kind of self-management, preventative model, and focusing more on wellness. So we're hoping we're going to get Welsh Government support as well.
So if there were other healthcare professionals in a position where you are wanting to bring this into perhaps their area, would they also benefit by contacting you to help with setting up the model and discussing anything like that?
Yeah, so I get messages all the time, either via Twitter or LinkedIn or Instagram, or just email, because I'm always happy to share everything I've learned. There's a big push. We've got a lot of lifestyle medics in Wales, so I'm actually part of a WhatsApp group with 120 other doctors who are focused on bringing this lifestyle medicine into the norm. We want to create this kind of patient focused lifestyle medicine way of working, and I think that's kind of going to be the future for health in Wales. I think it's so inspiring. I think it is, and listeners might know I'm a yoga teacher, so I mean this is like right up my street about that whole holistic approach that you say, and all the knock-on effect of how you feel affecting your physical health and your mental health. So it's been an absolute pleasure having you here. Is there anything else that we haven't discussed, or that you'd like to say again or share with our listeners? I would just say that if you are at home and you feel like you've got a long-term health condition that is kind of wearing you down and making you feel really isolated, then please do contact us, because that's exactly who we're here to support. And there's lots of people who have said, that they were at their wits' end and they just didn't feel like they had any life quality anymore. And their lives have been transformed. So you never know how good you'll feel until you throw yourself into it and come and be supportive with our coaches. They're such good people who are so motivated to help you create the life you want. So please do get in touch, because we're really keen to help and support. And that's fantastic. And I think often that's it. People don't know, do they? Don't know either that something exists, or they don't know what they need to do to help themselves and where to go. And hopefully we've brought this to a lot of people now, our listeners. And maybe it's not you, perhaps it's somebody who's suffering, and you can share that with a family or friend member or a work colleague and let them know about WISE. And then it'll just make whatever, if someone is on a waiting list waiting for surgery, for example, or they're waiting for an intervention, it'll make that more powerful. They'll have much better outcomes if they've got this foundation that WISE can give them. Thank you so much, Dr. Liza. Thank you. Thanks.